Today's ICD-10 quick coding tip focuses on understanding how to code chronic obstructive pulmonary disease, otherwise referred to as COPD. My name is Claire and I'm an inpatient coding auditor. In my coding tips and tricks videos, you'll discover valuable insights to help sharpen your medical coding skills and code with confidence. If that sounds like something that would be helpful to you, please consider hitting that subscribe button so that you can be notified whenever I release new content. COPD refers to a group of diseases that result in airflow blockage and difficulty breathing. COPD is a chronic condition for which there is no cure. According to Coding Clinic from third quarter 2007, if there is documentation in the medical record to indicate that the patient has COPD, it should be coded. This is true even if it's only listed in the history section, as long as there's no contradictory information, because COPD will affect the patient for the rest of his or her life and almost always will require some form of continuous clinical evaluation or monitoring during the hospitalization. There are several specific lung diseases that fall under the general term chronic obstructive pulmonary disease, with emphysema and chronic obstructive bronchitis being the most common. When the diagnosis is stated only as COPD, review the medical record to determine whether a more definitive diagnosis is documented. Code J449, chronic obstructive pulmonary disease unspecified, should only be used when a more specific code cannot be assigned. For instance, if it's noted throughout the record that the patient has COPD, and a pulmonary consultant who sees the patient during the hospitalization documents that the patient has emphysema, only the code for emphysema should be used since it represents the specific type of COPD. ICD-10 has codes to differentiate between uncomplicated cases of COPD and those in acute exacerbation. An acute exacerbation is a worsening or decompensation of a chronic condition. Examples of terms that indicate an acute exacerbation are exacerbation, inexacerbation, decompensated, acute exacerbation, exacerbated, and uncompensated. When COPD exacerbation or decompensation is documented in the medical record, assign code J441 for chronic obstructive pulmonary disease with exacerbation. Only the one code is needed to completely capture the diagnosis. Do not assign J449 unspecified COPD as an additional code. There is also a specific code used to distinguish between uncomplicated cases of COPD and cases of COPD with a lower respiratory tract infection. Code J440 is used to capture COPD with lower respiratory tract infection. Coding Clinic has provided guidance on which infections are considered to be lower respiratory tract infections, confirming that both pneumonia and acute bronchitis fall under this code. Therefore, J440 can be assigned when a patient with COPD is diagnosed either with acute bronchitis or pneumonia. It's not necessary for the physician to explicitly state a relationship between the lower respiratory tract infection and COPD because these conditions are linked in the alphabetic index by the word with. When coding COPD with a lower respiratory infection, a code should also be assigned to identify the infection as indicated by the instructional note found at J440. This note advises that two codes may be necessary, but does not provide guidance on the order in which they should be listed. So the sequencing of these codes will depend on the circumstances of the patient's admission. For instance, when a patient is admitted for treatment of pneumonia and has a known history of COPD, you would assign the code for the pneumonia as the principal diagnosis, since this was the condition responsible for the inpatient admission, followed by J440. It's important to note that besides clarifying which infections are included in the code for COPD with lower respiratory tract infection, Coding Clinic has also identified certain conditions as not being included in this code. For instance, influenza is not included because influenza involves both upper and lower respiratory infection. Additionally, aspiration pneumonia and ventilator-associated pneumonia have been clarified as not being included in this code. This is because the ICD-10 codes for these two forms of pneumonia do not fall within the respiratory infection codes. Rather, the code for aspiration pneumonia is listed under the section titled Lung Diseases Due to External Agents, and the code for ventilator-associated pneumonia is under the section titled Intraoperative and Post-Procedural Complications and Disorders of the Respiratory System Not Elsewhere Classified. When coding for a patient with COPD exacerbation or COPD with lower respiratory tract infection who has been specifically diagnosed as having emphysema, assign both the code for emphysema and the code for COPD exacerbation or COPD with lower respiratory tract infection to completely capture the diagnosis. This guidance is a result of the fiscal year 2024 updates and represents a significant change in how COPD with emphysema is coded. Previously, the rule was that only the code for emphysema should be assigned in cases where a patient experienced a COPD exacerbation or COPD with a lower respiratory tract infection due to an excludes one note that prevented the two codes from being used together. Emphysema was considered to be the more specific code for COPD in these instances since it represented the specific type of COPD. However, effective with the fiscal year 2024 updates, this excludes one note has been changed to an excludes two note. This means that it is now permissible to assign both the code for emphysema and the code for COPD exacerbation or COPD with lower respiratory tract infection together in order to accurately capture the clinical picture. This is because an excludes two note means that it is acceptable to use both the code for the condition being referenced and a code for the condition listed in the excludes two note together when appropriate. For example, if a patient has been diagnosed with a COPD exacerbation and the medical record documentation specifies the COPD to be emphysema, both the code for the COPD exacerbation and the code for the emphysema should be assigned. This is because both codes are required in order to completely capture the diagnostic statement. The emphysema codes alone do not completely convey that the emphysema is exacerbated. So that's it for today's quick tip. I really hope that this video was helpful for you. If it was, please give it a thumbs up, and if there's any topics that you would like me to cover in the future, just leave a comment below and I'll add them to my list. Thanks for watching, and until next time, happy coding!